Hey folks, it's Casey Ashby, back in the office again this week. I've been off for the past 2 weeks. Like we told you before, we're trying to limit our patients that we're seeing here in the office. So Dr. Shapiro was here last week, before that was Dr. Berry, so I'm back in. So I'll be here all this week, try to get some content posted for you so we can learn some more about ear, nose, and throat issues. So today what I want to talk to you about is recurring ear infections or persistent fluid, specifically as it deals with kids. Just about everybody either has a child or knows somebody with a child who's had problems with recurring ear infections. This is a very, very common issue that we see. The vast majority of patients that are sent to us are patients who have been to their pediatrician multiple times. These are kids who have had ear infection after ear infection. They've been on so many antibiotics at this point. By this time, the parents are fed up with it. It's not uncommon for kids to start to develop a rash or upset stomach from the antibiotics, and you really just hate to have your kid on antibiotics all the time like that. We also see kids who get fluid in the ear that doesn't go away. And it's not necessarily an infection, but when there's fluid behind the eardrum, that can impede the hearing. So here's the process for when kids come to see us for these recurring infections. If you get sent from your pediatrician, you'll come to our office. The very first thing you're going to do is meet with our audiologist. The audiologist is going to test the hearing. Now, I know it sounds like a difficult task to test hearing in kids, but we can usually get some useful information from it. The audiologists have different ways of testing hearing in kids. It's not like for adults where, press the button when you hear the beep. Sometimes they have to do what's called play audiometry, where the kid drops a block in the bucket when they hear the tone. Sometimes they just kind of condition them to turn their head when they hear a specific sound. That way they can at least get some sort of useful data from the hearing test. They can also do what's called a tympanometry, and that's essentially a pressure test. It measures the mobility of the eardrum. If you've got fluid like infection or not even non-infected fluid behind the eardrum's not going to move as well as it should, and it's going to be stiff, and that's going to show up on our tympanogram. For somebody who has a nice healthy ear, we're going to see a nice peak on the tympanogram. Not the case in kids who have fluid behind the ear. So after they see the audiologist, then they're going to come and see me or one of my partners. We're going to do a thorough examination, evaluate the kids, and see if it looks like there's persistent fluid or active infection behind the eardrum. I've got a little model with me here. This may be somewhat helpful, may make things maybe a little more confusing. But this is kind of the picture that I will show parents when we are dealing with ear infections. So I'm going to hold this up for you to see. When we're looking at the ear, we've got the outer ear. That's the part everybody knows. Here's the ear canal. This is the part that you're not supposed to put Q-tips in. Deep down in the ear canal, we've got the eardrum or tympanic membrane. Behind the eardrum on the other side, this area right here, it's called the middle ear space, which is why when kids have ear infections, we call it otitis, meaning inflammation of the ear, media, middle ear. So this space right here is supposed to be filled with air. When it gets an infection, this area is essentially full of pus or infection. And if there's not infection, it's just fluid, we can see body fluid, serous body fluid, sometimes mucoid body fluid, where it's really, really thick like rubber cement that sits in this area. And if you've got fluid behind the eardrum here, the eardrum is not going to be able to vibrate and move the way that it should. And if that happens, that can cause a hearing loss. Now, the hearing loss in kids, if it's because of fluid, it's reversible. Once we get the fluid out of there, the hearing should come back up to normal. Now, the root of the issue is the eustachian tube. That's the tube that goes all the way from your ear into the back of your nose. Everybody's had a really bad cold where their head feels plugged up, their ears just feel plugged and stuffed. That's because the ears and the nose are connected. If your nose is stuffy, if it's obstructed, that can give you that pressure fullness in the ear. And with kids, if they're not able to equalize that pressure, you know, when you yawn and pop your ear or plug your nose and blow. If kids can't do that, then they can develop negative pressure in the ear that brings fluid inside the ear. Oh, we have a special guest, Dr. Michael Foster. He's a neurotologist, specializes in this stuff, so I'm not sure why he's watching, but maybe he can teach me a thing or two through Facebook. Anyhow, I've also got this bigger, more exciting model of this giant ear. Again, we've got the outer ear here. I'm going to try to open this ear for you. Open the temporal bone. Again, we've got the ear canal. Deep down in is the eardrum. The eardrum is a complete barrier from the outer ear to the middle ear. So fluid cannot get out, fluid cannot get in. So remember, getting fluid in your ears, that's not from bathing, it's not from swimming. This fluid is because the eustachian tube is not working the way that it should. It can be hereditary. We oftentimes see in kids who have recurring ear infections or persistent fluid. Oftentimes parents had the same types of issues. We will see in kids with really bad allergies that can contribute, and also in kids who have secondhand or even third-hand smoke exposure. Secondhand smoke, we all know that's when there's cigarette smoke in the vicinity, but third-hand smoke, that's when it's on your clothes. And if you smoke and you've got smoke on your clothes, that's still very inflammatory to the nasal passages and can affect the eustachian tube and put kids at risk of getting recurring ear infections. So, question is, what can I offer for these recurring infections or this persistent fluid? What I can offer is what's called pressure equalizing tubes. You probably heard of kids getting tubes in the ears. These are, I thought I had one here. Guess not, sorry. Pressure equalizing tubes are these very, very teeny tiny little buttons, essentially. And these teeny tiny little buttons sit in the eardrum. So they sit in the eardrum right here like a little porthole, a little window. It allows air to get in and it allows any fluid or infection to get out. This is done in the operating room. The child is asleep. The anesthesiologist will provide just a little anesthesia to breathe. The child falls asleep. It literally takes me 1 minute per ear to do. I make a very small opening in the eardrum, drain any fluid out, and the little tube just sits in the eardrum. You're not going to see the tube. The child isn't going to be able to feel the tube. You're not going to be able to look in the ear and see it. They're not going to be able to touch it with a finger, nothing like that. These tubes will typically stay in for anywhere, usually about 6 months to a year, year and a half. We hope for that little longer period of time to give the child a chance to outgrow this issue. Most kids will eventually outgrow it. Now, while the tube is in, there's a few precautions that you have to take. For the most part, bathing, showering, swimming on the surface of a pool, you don't have to do a whole lot for it. If it's an older kid and they're going to be swimming underwater, if you're in a water park, or if you're in lake water or ocean water, you probably want to use a waterproof earplug so that dirty water doesn't get in there. Now, the purpose of the tubes significantly reduces the risk of your child getting another ear infection. However, you can still get an ear infection even with the tubes in. But if there's an infection, you're going to know that there's an infection because you're going to see goopy pus essentially draining out the ear. Gross, I know, but the nice thing about that, then you don't need antibiotics by mouth. All you need is ear drops. The ear drops will get down through the ear, go down through the tube, and clear up the infection that way. And it's important that if you do start to notice that drainage, please give us a call. What we don't want to happen, we don't want that drainage getting in the tube, sitting there, drying, and then it prevents the eardrum from draining properly. And then essentially we may need another set of tubes. So again, the tubes are going to stay in 6 months to a year and a half. Sometimes they come out too soon. If they do come out too soon or if they get clogged, we may have to go back sooner than expected and replace it. Sometimes they stay in too long. If they're in for years and years, sometimes we'll have to go back in, remove the tube, and patch the eardrum. That's fairly rare. Now, any surgery that we do has potential risks associated with it. The of putting a small little tube in the eardrum is the very, very small risk that the tube could fall out and leaves a small hole in the eardrum or a perforation. If a perforation persists and doesn't heal on its own, most of the time they will, if it persists, it may require another procedure later on down the road to patch it or repair it. Now, if there's all that fluid behind the eardrum and we put the tube in, your child's hearing is gonna improve essentially immediately. And the process after that, usually 2-3 weeks after the surgery, you'll come back in, we'll do another hearing test, make sure everything's back to normal. After that, we like to see it every 6 months until the tube has come out. That way we can check it, just make sure everything looks healthy. And if there's any problems before that, you just need to call us. If there's drainage, if there's obvious infection, just call us. We'll usually be able to send in some eardrops for you. Saves you a trip to the doctor's office, saves you from having to put your kid on all those antibiotics that you didn't want to have to be on in the first place. So that's about all I have on ear tubes right now. Of course, there's multiple things, other things, details we could talk about, but that's the gist of it. In short, significant reduction in ear infections, generally improvement in hearing if there's fluid that's impeding the hearing mechanism. And for the most part, parents are very, very happy that they had it done. And of course, this is only for kids who meet our criteria. For the most part, we usually will say kids who meet the criteria are kids who have had maybe 6 infections in a year or 4 infections in 6 months, or if they've had persistent fluid for longer than 3 months. Now keep in mind, most of the time when you get a fluid in the ear or you get an infection, most of the time it's going to clear on its own. Most of the time you don't need to do anything. If that fluid's not infected, you do not need antibiotics. So most of the time fluid will clear up on its own, but when it doesn't, we're here to help. So please, if you have any questions, comments, criticisms, please leave them in the comments below. Hopefully I'll have another video for you later this week. I'm here all week, so if you have a certain topic that you're interested in, please let me know in the comments, and I'll see what I can do to address it. So I hope you're all doing well, staying safe. If you guys have any questions, please feel free to contact us via Facebook or call our office. We are currently doing telemedicine appointments. We're only seeing urgent or emergent patients here in the office. So if you have an issue or you're an established patient or even a new patient and you'd like to talk to an ear, nose, and throat doctor, call us. We are doing appointments by phone. We have a nice little system where on the computer, we can do face-to-face. It's almost like FaceTime, but it's through a HIPAA secure setup so that there's no risk of exposing confidential information. So you should have our number in the Facebook app. So if there's any issues, please let us know. All right, folks. Good to see you all. Take care.